Welcome back. The Health Department is calling for extra caution after 3 new Mpox cases were recorded in the country. The cases were all recorded in Ekurhuleni, and the first patient had a travel history to Kampala in Uganda. For more details, I'm joined now by Health Department National Spokesperson Mohale. Mr. Mohale, thank you so much for your time and for joining us this evening. Is there a cause for concern regarding the latest cases of Mpox, especially with the 3 that have been found in Gauteng? And what do we know about these 3 confirmed cases?
Good evening to you, Katlego, and good evening to your viewers at home, and thanks for this opportunity once more. Yes, as the Department of Health, we can confirm that 3 positive cases of Mpox have been detected recently in the country, all of them in Gauteng. The district is Ekurhuleni. There's no need to panic, as we know that the outbreak of Mpox in the country was announced last year in May, and between May and December, we recorded laboratory confirmed cases, about 25 of them. So these 3 are the first cases that have been detected in the country. So on the continent, about more than 20,000 cases have been detected on the African continent. So 3 cases, there's no need to panic in the country, but that doesn't mean people must relax. They must continue to practice personal hygiene at all times.
Most certainly. I mean, it would start with just 3 cases, and we don't know how far it would escalate in getting to the 20,000 number continentally. So what steps is the department then taking in response to these recent cases? Are there specific measures that you are implementing to contain the spread?
Yes, there are a number of programs and activities that we have in place. Number 1, we've been raising awareness about Mpox, just like other diseases which are under what we call notifiable medical conditions. So these are the diseases with potential to create outbreaks or epidemics or pandemics, just like COVID-19. So we learned lessons from COVID-19 outbreak. So we continuously raise awareness using different platforms, different channels, to encourage anyone who experiences symptoms of Mpox. Of course, these are not unique symptoms. We talk of a rash which can last between 2 to 4 weeks. We talk of fever. We talk of swollen glands. So these are some of the symptoms that we want to urge anyone who experience these symptoms with or without travel history to countries or regions currently experiencing the outbreak of Mpox to say, please don't self-treat yourself, don't self-diagnose yourself. Just go to the nearest clinic, healthcare provider, or hospital in order to seek medical care. So it's only the clinicians or the doctors who can be able to diagnose you, to test you, to tell whether you are infected with Mpox or any other disease. Hence, I indicated that the symptoms of Mpox are not unique from symptoms of other diseases like your flu, like your COVID-19, and so forth. So the best way is to seek care instead of continuing to go to public spaces.
So in 2 of the 3 cases that you found, there was a male who's 30 years old and a 27-year-old female who were found through contact tracing. How extensive is this process? Are you hopeful to find more cases through contact tracing?
Yes, also I need to indicate and emphasize that the success of the contact tracing activities by outbreak response team, here we talk of healthcare workers, depends on a cooperation from those who tested positive. For example, if you test positive, but you don't reveal other people that you were in close contact with in the last few days, that makes it difficult for our healthcare workers to effectively conduct contact tracing. So we want to thank this patient who openly cooperated with our health officials during contact tracing, and also directing us to these 2 patients who also tested positive, meaning that the cooperation of those who tested positive with our healthcare officials will enable the government in collaboration with other organizations in the sector to prevent further widespread of this disease, this infection, preventable disease such as Mpox.
And are there specific groupings that are more susceptible to getting Mpox?
Anyone can contract Mpox regardless of age, regardless of gender, regardless of sexual orientation or the race. So hence we say this is one of the diseases which has got no discrimination. So as long as you practice preventative measures, if you suspect that your loved one might be experiencing Mpox symptoms, please try to refrain from physical contact. Here we talk of kissing, engaging in unprotected sex. So these are some of methods of transmission of this disease. So, and also we want to appeal to members of the community to stop stigmatizing anyone who openly disclose that they are diagnosed with Mpox, because stigma is one of the factors which prevents people from going publicly to test, to screen, and also to take a treatment prescribed by the doctors or the healthcare workers. So stigma, we should not allow stigma to contribute to further spread of this preventable disease.
I mean, you spoke a little earlier on in terms of the lessons that have been learned from the COVID-19 period. And yes, there are only 3 cases that have been detected in Gauteng, and I believe it's a total of 28 in the country as a whole. How prepared is the healthcare system in handling potential increases of these Mpox cases? Are there specific resources and protocols that have been put in place?
Yeah, the fact that we managed to rapidly identify the patient and also detect other cases which are linked to this is that shows that our response team, our strategies to prevent further spread of any outbreak, not only Mpox. Remember, a few days ago we were talking about hand, foot, and mouth disease experience in the province of KwaZulu-Natal, and I can confirm that through the collaboration with the province, the district, and other international organizations and local organizations like your National Institute for Communicable Diseases, the World Health Organization, we managed to contain further spread of that disease. So collaboration is one of the contributing factors for us to be effectively prevent further spread of this disease. But also we want to appeal to members of the community to work closely with the healthcare officials, but also want to emphasize that they need to stop stigmatizing those who are diagnosed with any of this disease, whether it's Mpox, whether it's foot and mouth disease, or any other disease. We need to work together as the country to prevent the further spread of the disease and also to protect our loved ones.
I mean, we do know that the virus is circulating quite rapidly in the DRC as well as in Uganda. Are you paying a close attention to those who are traveling to some of these countries when they come in and out of the country with regards to them being safe from Mpox?
Yes, we've been working. Yes, we work with a number of stakeholders, including the Border Management Authority, but also we have communicated the message, especially to we've got a number of companies locally in South Africa who have got operations in countries like your DRC and Uganda. We also emphasize the message that if any of their officials who are currently based in those countries and want to return to the country, they need to try by all means to delay their return as long as they experience symptoms of Mpox, so that we're able to prevent further spread of this disease in case they contracted the disease. So we continue to communicate this message locally and internationally in order to ensure that we are able to prevent further spread of the disease around the country.
And any vaccination options that are available to residents?
Globally, there's a very shortage of vaccine. Hence, for now, we were able to treat the symptoms of Mpox using the treatment of other diseases like your smallpox or chickenpox, and also so that. But we do have a limited stock of Mpox specific treatment called tecovirament, which is limited not only in the country but globally, because the disease is not endemic, meaning that it's not commonly found in most parts of the world. That's why even the treatment is very scarce. So we have got a limited treatment in the country through the support of the World Health Organization country office, but that is only for severe health complications. But just for normal complications or signs and symptoms, we use other treatment for other health conditions, which has proven to be effective. So hence we say for South Africans or anyone who experience the symptoms of Mpox, we have got ways to deal with such symptoms before they cause serious health complications. So they don't need to waste time. They need to go to the nearest healthcare facility. But also, once diagnosed, they need to comply with the advice of medical officers or the healthcare workers. If we say you must go and self-isolate, you remember during the time of COVID-19, those who are diagnosed with COVID-19 were encouraged to go and self-isolate if they cannot go to the isolation centers.
All right, Mr. Mohale, thank you so much for your time and for sharing these insights with our viewers. That's the Health Department National Spokesperson, Mr. Foster Mohale, speaking to us there after the 3 new cases of Mpox have been discovered in the Gauteng province, though the department does say this is not yet a cause for concern.